What might happen when things go wrong with the pelvic floor? So we're going to talk about a couple scenarios. If the pelvic floor muscles are too tight or too tense, they're not able to contract and relax well, and this can actually make them weaker or not able to do their job well. Think about if you were walking around with your fist clenched, and all of my hand muscles are really, really tensed up right now. This is really not good for anything else except maybe walking around and punching someone because my muscles aren't able to relax and move. We need muscles to be able to contract and tighten, relax and stretch, and move and coordinate with other muscles. And if the pelvic floor is too tight or tense, this can be from stress or other issues going on that cause this muscle tension. It can be problematic and lead to symptoms of bladder issues and other pelvic health issues. On the other end of the spectrum, what happens if the pelvic floor muscles are too lax or loose? If muscles lack tension, then they cannot contract as well as they need to, and they may be weak because they don't have that tension there. And if some muscles are too loose and weak, other muscles might overcompensate. We see this commonly when the pelvic floor and the abdominal muscles are really lax and loose and weak after childbirth and delivery. Then what happens is the other muscles of the canister, the diaphragm, and especially the back muscles can overcompensate and get overworked and potentially have pain issues. So how do you know if your pelvic floor muscles are too tight? So some symptoms of pelvic floor muscle tension include constipation, pain with sex, pelvic pain, inability to empty your bladder fully, pain with urination, or urgency and frequency. So if you're experiencing any of these symptoms, I recommend that you partner up with a pelvic physical therapist to assess what's going on with your pelvic floor muscles. And this is especially the case if you're thinking of starting some type of a pelvic floor strengthening program because you've been told that your muscles are too weak and that's why you're having leakage. So we can have leakage when things are too tense as well. And if we try to just strengthen a muscle that's already tensed up tight, we're just going to make it more tense. So we need to first get it to relax and let go, and then get it to move in a nice, strengthened and supported way. On the flip side, how do you know if your pelvic floor muscles are too weak? So some symptoms of pelvic floor muscle weakness include bladder leakage, urinary urgency and frequency, which yes, that was on the last slide for too tight. There can be overlap. Stool or gas leakage, pelvic organ prolapse. That's when your pelvic organs start to drop down into the vaginal canal. We can have sexual dysfunction where we are having arousal issues or inability to orgasm. And we can have pelvic girdle pain where that whole pelvis just feels kind of weak, unstable, and maybe painful. So as we move forward talking about different bladder issues and pelvic health issues, we're going to focus a little bit more on the weakness side of things, but I wanted you to know about the fact that the muscles can have more than just being too weak as a problem area for them. But pelvic floor weakness is a very common thing that many people experience. So what can contribute to it? The main reason why women tend to have it more than men is because women can get pregnant and deliver babies. And especially when we have a vaginal delivery, that vaginal delivery can stretch the tissues up to 13 times the normal length. And that can put some significant stress and strain through the pelvic floor, and it may have trouble recovering from that. So pregnancy and delivery are both things that can contribute to pelvic floor weakness, as is trauma to the pelvis and abdominal walls. So whether you've been in a car accident, or maybe you've been kicked or hurt in the abdominal area or pelvic area, that trauma in the area can lead to pelvic floor weakness, as can lack of pelvic floor and core exercises. So these are muscles like anywhere else in our body. And if we don't use it, we lose it. So if over time, these muscles will get weaker if we're not used to exercising them. Abdominal and gynecological surgeries can disrupt the muscles and potentially cause issues that way. So especially if you've had C-section, hysterectomy, bladder sling, pelvic organ prolapse repair, hernia repair, all of this can disrupt the normal coordination of that core canister and can contribute to pelvic floor weakness. If you are someone who constantly bears down or strains through the pelvic floor in your daily life, over time this can contribute to weakness. So if you have a history of chronic constipation and you're straining real hard to have a bowel movement, or maybe you work in a job where you have to do a lot of repetitive heavy lifting and you're holding your breath and straining to lift, Both of those scenarios put a lot of downward pressure through the pelvic floor and can weaken it. If you are dealing with respiratory issues and you have a chronic cough, that repetitive pressure down from the cough can cause pelvic floor weakness as well. Last two things that contribute to weakness, obesity. So the extra weight that we put on when we are overweight, that too puts more pressure down through our pelvic floor and can potentially weaken them over time. And another reason why women are especially susceptible to weakness of the pelvic floor is that they go through menopause. And when our body hits menopause, we lose some of the hormones and the estrogen content in our body, and our muscles begin to atrophy a little bit more at this point and to lose some of their suppleness. And this can lead to pelvic floor weakness.
Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.